We talk a whole lot about the healthcare crisis in America and the 50 million people who have no health insurance and the people who die because they don't get to a doctor and the high cost of healthcare. And all of those issues are enormously important. But when we talk about healthcare, it is also important to talk about dental care. 1/4 of people 65 or older have lost all of their teeth. Many of them have dentures. Some of them don't. Only 45% of Americans aged 2 and older had a dental visit in the past 12 months, and more than 16 million low-income children go each year without seeing a dentist. It is a serious problem for low-income Americans, for racial or ethnic minorities, for pregnant women, for older adults, for those with special needs, and for those who live in rural communities. Simply put, which is often the case in terms of social services, the people who need the services the most are the ones who get it the least.
We in Maryland, Senator Cardin and myself, feel a very poignant and compelling responsibility in this area because 5 years ago, a little boy named DeMonte Driver, living in Prince George's County within the shadow of the capital of the United States, died because of an infection that he incurred because of the failure to have access to timely dental care. We feel the best way to honor that little boy's memory is to continue to fight so that no little boy, no child in America goes without universal health care and goes without access to dental care.
The mouth is an essential body organ, essential to eating, breathing, communicating, sensing, and protecting our bodies. It has specialized tissues, and when they're not healthy, the impact is both immediate in pain and infection and chronic in the exacerbation of medical conditions, as you've mentioned. Oral diseases impact function, appearance, employability, school performance, and even military readiness. It stresses families and it presses community services. And on this anniversary of Diamante's death, thank you for putting us in that context, Senator Mikulski. It certainly does drive home the point that it can have even dire consequences.
We released a costly dental destination yesterday that documents the problem of people showing up in emergency rooms for dental care. It is a symptom of a failing system, and it is a huge waste of money. The report estimates that in 2009, there were more than 830,000 ER visits nationwide, which is a 16% increase over 2006. So we're going in the wrong direction. These are the wrong services in the wrong setting at the wrong time for desperate people who have no other alternative. 47 million Americans live in areas that are federally designated as having a shortage of dentists. And at this point, more than a dozen states are looking at developing new types of providers to expand the dental team and work under the supervision of a dentist to reach more people. Because roughly we have about 1/3 of the population left outside of the current system, and that's just too many.
Like other federally qualified health centers, our patients are largely low income and experience problems with access. 91% of our patients are either covered by Medicaid or have no dental insurance. While primary medical care is central to our mission and represents the bulk of services we provide, there's an increasing body of evidence that highlights the significant impact of oral health on a patient's overall health and links to other serious healthcare conditions such as heart disease, atherosclerosis, diabetes, poor nutrition, etc.
With great joy, I provide oral health services to the vulnerable patients we're talking about today. On the ground, the truth about oral disease and poor access to dental care is clear and undeniable to me. My staff and I have declared war on the diseases that affect these patients, and we're dedicated to win it. I have 2 delivery models. One is a vulnerable nursing home, nursing facility model, and the other is treating Medicaid-eligible children in schools.
I'm very proud that my home state of Minnesota is the first in the nation to create a license for mid-level dental providers called dental therapists.
Currently, I'm seeing probably about 50 patients a week. Many of them I'm triaging and funneling into either hygiene or doing the work myself, or if it's something beyond my scope of practice, I'll get it referred to the dentist.
This is an issue that this committee is going to stay on, because I think it's an issue of enormous importance that does not get the kind of discussion and attention that it deserves.